Emergency preparedness and response plan for COVID-19 has been developed with a budget, and the National Department of Health reappropriated 3 million kina from its internal resources to step up response processes and clinical supplies. The National Executive Council recently approved a 45 million kina budget with announcements made by Treasurer Ian Lingstaki in Parliament of the first 10 million kina funding to be disbursed to relevant authorities, including the Health Department.
Budget-wise, the government has clearly given us the budget funding, and so now immediately we are working with Treasury to ensure that the 10 million that's required is brought to us for us to now execute. But within ourselves in the department, as we had alluded to before, we've got money also been allocated within our means to ensure that we will continue to escalate and execute. And that's about the amount of 3.3 million kina that's been allocated for us to use in terms of this response.
Giving numbers of the suspected cases as of 17th February, a total of 12,155 persons were screened at the different points of entry, and the health team has identified 312 persons as persons of interest and are being monitored regularly by the surveillance team. Health screening at Jackson's International Airport and at seaports continue, with further advisories to all arriving passengers to fill out mandatory health declaration forms. Protocol for isolation and quarantine of patients is developed.
Up to this point in time, we don't have any coronavirus, and that's a result of all the testings that have been done or screening processes that we have been executing through in the settings of a point of entry all up to this time, and the figures that I'm getting is around about 13,000. That's how much, like the number that have come through this process. And out of them all, about 300 have been those of interest. And from those 300, there were 8 that we had to get through for investigation. And so far, those testings have been negative. And so that's where we are at in terms of trying to be vigilant in approaching this outbreak.
Meanwhile, 300 kgs of personal protection equipment was shipped in yesterday from Dubai into Port Moresby.
WHO urgently shipping about 300 kilograms of the personal protection equipment from Dubai to Port Moresby yesterday, and hand over this one to Health Minister himself. So the content of this including protective goggles, which is used for putting in eye, and examination gloves, a face mask, a respirator, and a surgical gown. Those will be sufficient for the health worker to respond first initial 15 patients. I think that is critically important to ensure our health worker are protected, and there is a kind of urgent gap. With WHO, we're happy to ship in to provide this support.
The department is working hard with all relevant stakeholders to ensure the people are protected from COVID-19, and should any case be found, will ensure the concerned is cared for. But it is also the responsibility of the general public to ensure they adhere to health messages being given through various media outlets.
The misinformation also has been handled. We had to go through the process of communicating with those concerned so that they must abide and follow the right protocol, because these are real big messages or issues. So it has to come up to the appropriate levels to make those kind of qualified statements, if you like. And so our team is working with the private to get them to be on board, so that they clearly understand where their role is and where we as the national response, where our role is, so we all follow the protocol.
Annette Cora, National Emtv News.